Okay, so we are live with Dr. Martell, our Winnebago County Public Health Administrator, and we are really fortunate to have her. Before we begin with any questions and discussions with Dr. Martell, and as we wait for more people to get on, I just want to share a couple of pieces of information with citizens that are important. First, I want to let everyone know that there is a pop-up market with Northern Illinois Food Bank. It's this Saturday, noon to it says noon to noon. I'm sorry, guys. So it's pop-up market with Northern Illinois Food Bank from 9 a.m. to noon at the former Circuit City parking lot on East State Street. So again, that's 9 a.m. to noon. My apologies. It's the Northern Illinois Food Bank at Circuit City parking lot. Also, we at the city have been doing a civic education forum. Our next session is coming up, and that is going to be Tuesday, March 30th at 5:30. It's going to be right here on Facebook Live, and we're going to dive into what the City of Rockford's Human Services Department does for our community. And we're really fortunate that we have Anquinette Parham, who's our director. She's done a phenomenal job, especially during a really difficult year. And so I think that's something you'll want to tune in for. Last thing is we are hiring Rockford firefighters. So if you have an interest in joining the amazing Rockford Fire Department, which I would argue is the best fire department in the state, please, we are accepting applications until April 5th, and you can get those applications on the City of Rockford's website. So we are really excited. Let's get to the main topic. And Dr. Martell, you are popular. We have 52 people at this point watching us, and I just want to say before we dive in, just thank you on behalf of all Rockfordians for the tireless amount of time that you put in. I think a lot of people get to see you at a press conference, get to see you during interviews, and I don't know if they truly understand the amount of time and energy and the passion that you put behind the work that you do on behalf of all Winnebago County residents. I just want to say thank you. It's really been an honor to work with you during this really difficult time. You and your entire team have done a great job. So
thank you, Mayor.
No problem. And so we're going to dive right in. We got a lot of questions for you. And so I'm going to try to go as fast as I can, provide you as much time as you need to answer these. But here we go. Big question. How do you determine the priority for vaccination?
So again, I think we've heard a lot about this phase of vaccination, and we are following the phases as determined by the Illinois Department of Public Health. So within the phase, so for instance, if there's, phase 1B, we know was almost 2/3 of the population of Winnebago County. The next thing then was we look at things like health conditions, occupation, age, because all of those are in that phase 1B matrix. So the first grouping that we did were the over 65. So they were pulled through as a priority group, anyone over age 65. Now we're pulling through individuals that are under the age of 65 with health conditions and priorities, while simultaneously we're vaccinating what's called the frontline essential workers. So teachers, school staff, we are looking at grocery store workers, some of the manufacturing sectors, as well as we continue to go back and pick up things like healthcare workers that may have missed out of phase 1A or new into the profession, daycare workers and individuals like that. So we are simultaneously looking at individuals based on health risk, conditions, and age, and well as the phase 1B essential frontline workers, which is occupation driven.
Thank you. And we'll just kind of do rapid fire here because there's a lot of them. So lots of questions. Why isn't the mass vaccination site doing 1,350 vaccines per day?
So first of all, the capacity to administer vaccine is based on allocation of the vaccine. We are now up to 1,400 vaccinations per day. We are moving up to 1,500 vaccinations per day. So we are moving along steadily. And it was always the goal to roll up and anticipate and really expand the capacity of that site to deliver at least that amount at the fixed site. But I also want to remind the public that we're also doing these what I would call mobile sites. So we've been in the school systems vaccinating the school staff and teachers. We're in the essential workplaces vaccinating. So I think people get very focused on that one site at Sandy Hollow, which is an important site, but there's lots of teams going around on the other side doing some of these 1B essential work groups, as well as some of the assisted living, the independent living villages, communities that we have that were really not included as part of the federal pharmacy partnership. So those teams are out roving and vaccinating those individuals as well. So I always say it's the collective amount of all of those efforts. We want to at least get to that amount. And we are now surpassing that number on a daily basis at the fixed guard site in Sandy Hollow.
Okay, thank you. And why isn't the mass vaccination site on the west side of Rockford?
Well, first of all, I think we started to roll when we got notice that we were going to be able to do this. We selected a location that was accessible to roadways, transportation, and it had to have the ability to expand capacity. We kind of talked about that in the previous question. We also knew that that site had been well received and utilized as a testing site. So we knew the population was familiar with the location. It was accessible to other areas of our county. But I also know that we are planning for what we call a kind of and I know it's going to sound like almost a contradiction in terms, but a fixed mobile site on the west side. We are standing that up with support from the Rockford Ministers Fellowship group on the New Zion Missionary Baptist Church. So we are establishing a more, I'm going to say, fixed west side location. But in the meantime, we're also doing pop-ups that, people, you have to register, and based on zip code then, if you're in that area, catchment, you may be offered an appointment. It may be at a local school. It may be at a local church or, place of worship. The idea being we are going to use every strategy we can, east, west, from one end of the county to the next.
Absolutely. Thank you. And here's a question for you. Does the health department provide doses to all the various clinics in the entire county, meaning the hospitals, mass vaccination site, pharmacies, et cetera?
So we provide vaccines to currently. We get an allocation that goes directly to the health department, and we allocate to the guard site. So the Sandy Hollow clinics, all of our mobile sites. We also allocate to all of our health system partners, which includes their 3 hospitals, our 2 federally qualified health centers, Crusader Community and Miles Square, LP Johnson, in addition to Oak Street, as well as several of our, I'm going to say, occupational medicine providers that serve both the city of Rockford and Winnebago County, again, because we have phase 1B eligible frontline workers, so Marathon Health and Winnebago County Wellness. Retail pharmacies like CVS, Myers, Walgreens, and Walmart, they receive direct allocations from the federal government. So there are 2 different streams of wave vaccine come into the county.
Okay, and so now, because if we wanted to add another layer of complexity to everything, we now have 3 different vaccines. Why can't a citizen just pick which one they want?
And I know that's probably one of the most challenging questions we all receive, right? Because we're all used to choice. I mean, most of us like having the options, right? I like to pick what flavor of the coffee of the day that I want and how I want it brewed. But, here's the challenge that we have. We have 3 very effective vaccines. All of them have different challenges in terms of logistics. So when we first, when we get allocations, we may get differing amounts of each one of those vaccines. Obviously, things like the Pfizer vaccine that require reconstitution and ultra cold, you have to have certain storage conditions. The Moderna is frozen, but you have to defrost it, and it has a certain shelf life on the tables. And then you have now the Johnson & Johnson, which is Janssen COVID-19. We're going to kind of make sure we are using the correct terminology. And it has a different kind of challenge on it. So typically what we're trying to do is allocate, for instance, more of the mobile sites, one and done, I'm going to say is the Janssen COVID-19, because it's often hard, when we're doing certain populations, not everyone can return to a mobile site. People change employment. People aren't available on that shift the next time we go back. Then things like Pfizer, we typically are using at the fixed site. and using Moderna at some of our other locations. So the challenge is we typically have 1 to 2 at most at any given location. And we are picking up both first and second doses. So that's another challenge. So we have to make sure that whatever we give on the first, that we have enough for the second, as we all learned about this importance on that, structuring that. So that is the challenge. And so we inform that we will provide you with the vaccine we have. And of course, we've heard from both the national experts, statewide experts, and our local expert. Take any of the 3. They are all highly effective at preventing, significant disease, hospitalizations, and death.
Okay, so this is a question we've gotten just a lot of. Let's say I'm a citizen and I'm in phase 1B. Why have I not got an appointment yet?
Well, first of all, I can't speak to an individual specifics because, for instance, today we got a call from someone who said they hadn't gotten an appointment, but they hadn't been registered. So number one, are you registered, right? So it's hard to say because I want to say, and I've told you about different systems now providing vaccine. So when I allocate vaccine into the health system partners, they will actually call you from their electronic health records to schedule you an appointment. So you have that mechanism. Then you have the health department. So you're registered on our system. If you are part of 1B, we are pulling through individuals every day based on their eligibility. Remember, I told you what the criteria were. So we're looking at age, we're looking at occupation, we're looking at health conditions, and we're pulling individuals through and offering them appointments. And then we have a third way, which is we know if you're going to Walgreens or CVS or Myers, you're registering on their system. So any one of those you could be scheduled to an appointment for. I say again, take the first available appointment and show up to that appointment because we have that vaccine with your name on it, no matter who offers you that appointment. And if you're not getting an appointment and you've registered and maybe you were one of the first, please do contact us on our help desk. Sometimes we found some errors in things like email addresses. Maybe you have let it go into your spam email box. If you have not made us a favorite, it doesn't come to the top of your list. It may appear as a solicitation, and many of us hate junk email, so I get that. But do contact us if it's been, a couple of weeks and you're a phase 1B, especially if you're over 65, because we are really doing a high number of those individuals that, have gone through quite a bit of them based on our data right now, and let us know so we can take a look at what's going on with your registration.
Excellent. So below both Dr. Martell and myself, you'll see a link, and that's Winnebago County Health Department website. That is where you go to register. So I again would concur with Dr. Martell. Please make sure that you are registered. Make sure that people that that may not have access to the internet or may have difficulty navigating the internet, that you help them get registered. Now, Dr. Martell, let's say someone doesn't have a computer, someone doesn't have a connection to someone who can walk them through this process. Is there a path for them to get registered, and what is that path?
You can call us on the hotline as well. 5-319-6705. And again, we have individuals who will actually take the information verbally. They will send you the emergency use authorizations. And then when you're offered the appointment, they will call you back to schedule you that appointment. And we also have, again, the support from one of our municipal clerks. They may be calling you back on our behalf to schedule and work with you on that appointment. We don't want anyone left behind, as they say. So we do appreciate Rockford Public Schools has helped us on this one to put that out on the peach jar to all the students. If every student helped register at least one family member that didn't have access, that would help us immensely get everyone ready for vaccination, because registration is the first step, no matter what county you're looking at, no matter what system you're looking at, because then we know that you want and you're considering vaccination, and we will work to get you vaccinated.
Thank you. And how many people are fully vaccinated in Winnebago County?
Well, right now they're reporting that about 30, as of yesterday, and again, the data is from the state website, 32,749, which is 11.3%, 3% of the population. I know that's a lot of numbers. So roughly about 33%, 33,000 have been vaccinated, which represents about 11.5%. So we've got some ways to go yet here, folks. But every day we're adding, when you think about that, we're doing first and second doses. And of course, now that we've got the Janssen COVID-19, that's a one and done. And so that will also increase the percentages. And as vaccine availability increases, we expect that percentage to increase significantly in the number that have received full vaccination.
And since everyone thinks you have a crystal ball, can you answer this next question and tell me, when do you think everyone in the county who wants a vaccine will be vaccinated?
So I'm going to, this one, I really need my math students to help on this one. So if the goal is to vaccinate, I say 80% of the eligible population. Now, we know today the governor talked a little bit about what it would take to get us into phase 5. And I think I set my bar a little bit higher because I want herd immunity. But okay, we'll go with, how do we open up some more? But you look at our population being about 285,000, right? Give or take. And if we vaccinated 3,000 per day, and we assume everyone needed 2 shots versus 1, right? 2 to complete the series. Really, we vaccinated, 7 days a week. We're looking at July. That's my crystal ball, which I think is pretty consistent with what they've talked about July. But again, a lot of things are in there. We got to make sure vaccine allocations continue, that there's no hiccups. The weather's getting better, so we anticipate that at least weather won't be a deterrent, and that people show up for their appointments when they're offered and available. Because again, deferring vaccination will simply delay that process of getting us to that 80% vaccinated. And certainly, as we work toward getting to that whole concept of, phase 5 reopening, complete opening, right? We want to get our population vaccinated.
Yeah, and Dr. Martell, we hear often concerns, and maybe you can educate us here. Are there risks to getting the vaccine? Are there side effects that people should know about the vaccine?
Well, I think we're going to talk first about risk and benefit, right? So the risk of the vaccines, the most serious risk that's been associated with administration, especially of these vaccines, was the potential for an anaphylactic reaction, which is a life-threatening allergic reaction. But I want to tell the population that everyone works at clinic. I think if anyone's been vaccinated with us, you sit in that 15-minute to 30-minute observation area. The goal of that team is to be able to respond to any anaphylactic reaction. There were no deaths associated with the vaccination during the clinical trials. Obviously, this is novel, so we're continuing. But there's a 2% chance of dying from COVID if you contract it. So again, you're talking about that risk benefit. Are there side effects with the vaccine? Yes, you've heard the side effects reported. The number one side effect reported both in the clinical trials as well as Winnebago County, those for you who completed the survey that goes out at 72 hours after we vaccinate you, said arm pain. There was soreness or redness at the injection site. The other things were things like muscle aches, fatigue, and tiredness. About a third reported that. Headaches, a fever, or any combination of the above. Most of these side effects last for 24 or 48 hours versus some of the infections with COVID that may have a much longer lasting implication. So while there are side effects, they are manageable. And they certainly should not deter someone from vaccination, because the risk of contracting COVID is much higher than the risk of a side effect from these vaccines.
Thank you for that. And we often hear this as well. Why does it seem like some people are jumping in line to get the vaccine?
Well, sometimes I come back to, I think there's a little bit of a misconception, right? We have to be careful about judging other individuals. We don't know that they're jumping, right? Because first of all, we don't know their underlying health conditions right now, right? They may be phase 1B eligible. In your mind, they look like a healthy 25-year-old with no issues or concerns. And but you don't know what other conditions that they've reported that have pulled them through on that phase priority. And I think that that's an important concept. I know there's groups that are excited to be vaccinated and certainly are anxious and want to get vaccinated as quickly as possible, because I think they do understand that, like we said on one of the clinics, we were talking about the social benefits of vaccination. Not only is the physical benefit of protecting your health, there are social benefits. We're starting to see that. You can get together with other households that have been vaccinated. You can begin to travel. You don't have any concerns about some of those experiences that maybe you were, protecting yourself from without vaccination. You can visit your loved one in the long-term care facilities. We're beginning to open some of that up as they become vaccinated and as the population is vaccinated. So I think it becomes important to understand that that's why it is an honor system. When you sign off at our registration site, it says that you're providing factual information. We believe that you're providing us with fact, and we will prioritize you based on those conditions to get you vaccinated. But I caution anyone from, saying that people are jumping the line, because you really do not know those individuals and their risk factors.
Yeah, and are there other misconceptions that you think are important that we address, since we have some folks' attention tonight?
Well, I've heard a lot when I've been working the clinics that worries that this vaccine was developed too fast, right? That they didn't have enough clinical trials or studies. And again, I know that it feels very difficult, but I come back to some of these things think about in a simple way. It was the technology that made this available to us sooner. In times past, we would have had to learn how to grow this virus on medium cultures. And for those of us can go way back in our high school days at the plates, and we would strike them, and then we'd have to incubate, and then we'd have to grow it. The technology regarding on this has changed significantly. And I liken it to, think about it this way. In the old days, when I would, you might call your mom for a recipe, and she would say, I'll write it on a card and I'll send it to you in the mail, right? The time it took to prepare the recipe was the same. So the clinical trial, that length of time was the same. But the ability to get the information now, when you can do it through a web search, they can send it to you in an email, they can text you the recipe, is much quicker. So that technology to get as to the clinical trial was what really made it happen much quicker. But I do say, I understand it's a novel virus. We're learning something about it every day. But that's why it becomes important for all of us to participate in vaccination, report side effects that you're having, make sure that we're educating ourselves and the science community about what's going on as well. So we appreciate, the fact that it did come out quicker, but we use a lot of technology now that makes our lives simpler and certainly speeds up the process.
Absolutely. And we hear that some individuals who have contracted COVID-19 unfortunately seem to have long-lasting effects from it. Mm-hmm. And some are called, I think they're called long haulers. Right. What advice, what assistance is out there? What can you say to them?
Well, and I think, first of all, it's going to be, we have so many in our community that deal with chronic conditions, right? And it's learning to manage the symptoms. We're learning more about what those symptoms with this disease and kind of the long term is. But again, it may include things like rehabilitation to address your motor and cognitive skills. We hear about people having mental fog and retraining themselves, whether it's, things like motor skills, like working out, building up endurance, breathing exercises. And of course, I would be remiss if I did not talk about general health and nutrition, right? So we do need to make sure we're taking care of our immune systems on a regular basis, because that's part of this, getting adequate sleep. I think we can all kind of relate now that we've lost an hour initially here. It takes a while to catch up on that. Things like nutrition, eating balanced diets. We know the role of vitamin D now and the importance of that in immune system functioning overall. Things like breathing, meditation, if it's, those are the kinds of things we need to talk about, both physical, spiritual, and mental health as it relates to this, because if you're a long hauler in terms of chronic, but it can be managed like any chronic disease. And it's really beginning to kind of, there are probably no specialists at this point because it's novel. But I think it requires all of your team working together with you from your healthcare provider standpoint, and you also taking the actions necessary so that you can learn how to manage and really lead, a full life.
Thank you. And I think you touched on this a little bit before, but seeing that we're getting questions about it, can you tell us any more about the second site? I think you said it's at New Missionary Baptist, New Zion
Missionary Baptist Church, which is at Springfield and Kilburn. And it will be transformed from a worship space into a clinic space. We are working through that process, and the goal of that site will be to provide 1,000 vaccinations per week or more. They plan to run from, I believe right now, I want to caution people about hours and things because I don't want you showing up there yet because it's by appointment as well. And the idea being that we will have vaccine ready for you with your name on it when you are scheduled to that site. But the idea being that they'll run typically Tuesday through Saturday. And again, they're going to run a little bit, I'm going to say a little bit later, maybe perhaps to catch some of our working individuals as the summer hours start to, the daylight hours increase. But again, we are like everything else. We really are starting it out with an idea that, these can be adjusted just like the hours at Sandy Hollow. We found that, as we are getting in this next group of individuals that are under the age of 64, they're needing some hours that are a little bit after work hours, as we say, they going to come after work to get vaccinated. And I want to put a plug in for our Rockford Mass Transit District as well. For those of you who need accessibility and transportation, they come right to the door of the Sandy Hollow Clinic. They will drop you right off front. And of course, if you need paratransit, they also will take you to that site. So public transportation to that location. And again, we know that many of our faith-based community groups are working to help enroll and register and get people ready for vaccination as the West Side site opens up. But as I've said before, if you have an opportunity to vaccinate at any one of our sites or locations, please take that opportunity. We want to give you as many options and choices, maybe not on vaccine type, but certainly on location to get vaccinated to as quickly as you can and as conveniently as you can. And each site goal is under 30 minutes.
Awesome. And I can attest just watching folks move through there. You've done a great job. The National Guard has, Emergency Operations Center has, all the volunteers and staffs. It's a really testament to collaboration. So kudos to you and your leadership on that.
Well, the whole team, we could not do it without everyone. There is not a day goes by that all of us aren't putting our heads together and making a tweak and adjustment about how to improve the situation so we can improve the throughput and really I'm going to say your experience as a patient that comes through that to be vaccinated. Nobody wants to, after they've waited so long for an appointment and to get vaccinated, wait in another line to get vaccinated. So I think that has been a goal that we've all worked on to make that a positive experience for everyone who goes through that.
Yeah, not to sidetrack us, but I think, as difficult as this year's been, we often focus on kind of the ugly and sad struggle pieces of the year. But I came across something, I just wanted to tell you this. A woman I know, her first name is Teresa. I'll leave it at that because I doubt she wants any kudos for this. But she has sewed more than 2,500 face coverings for people. It's those small, just acts of kindness and generosity that I think people like me and you get to hear about and see. But it's just so remarkable, the spirit of Rockfordians and Winnebago County residents who are stepping up during these difficult times to provide hope. I see the hearts behind you, and you see kids doing that on residential homes. That lifts people's spirits, and it's something small, and some will poo-poo it and say it's not a big deal, but all of that is a big deal, and how we honor those healthcare workers. That's been the good part of COVID.
And we've seen it really when I think about our Medical Reserve Corps, and when you talk, and it sounds like very military, sounding, but it's not. Those are citizen volunteers that are the front face of when you walk into any of our locations. They are the greeters. They're the ones that welcome you into your community-based site. I also, we had students from the Rockford Public School System, the ambassadors, worked with us on Sunday with the Walgreens Initiative, and they were ambassadors to welcome people into their environments. These are your community members. So while we were fortunate to get an asset of a state resource, I want to remind the community that these are individuals, that these are your neighbors, your friends, your relatives, your colleagues that sit next to you every day, that have, helped us get through these times and really stepped up to help us on these clinics.
Yeah, so I want to switch gears, if it's okay, Dr. Martell. Today, Governor Pritzker came out with some new information, and he stated that on, I think it's April 12th, if you're 16 years and older, you now can be vaccinated. So I guess a two-part question for you on this. One, what's your reaction to it? And two, some people are saying that'll bring a big surge of needed vaccines. Do you think we're prepared for that?
Well, we are gearing up for it. I think the president kind of tipped the hat on that as well. If everyone heard the national address, he was going for May 1st. So we like to be overachievers in Illinois. So we are going for a little head start on that. But I kind of liken it like this. We keep, we're increasing eligibility, but we're kind of keep bringing back people. We're going to keep bringing people in. We're going to keep pulling, because not everyone, when their phase was ready for vaccination, were they ready for vaccination? So we're constantly bringing that group and bringing them in. And we've already encountered, for those of you who probably don't, some of our essential workers are under the age of 18 already. And so really trying to prepare and bring them in as well, because while right now we don't have a product license for anyone under the age of 16, we have to begin that process, because until our population is vaccinated, we really won't achieve that full herd immunity. We will get better at it. And of course, every time we get a new benchmark, we've got to really, I'm going to say, we really work to get to that benchmark, right? So we have already been taking those registrations. But again, we are going to continue to gather up those priorities and keep moving that along. We expect too that some of that will include some new essential work groups as well, some new frontline workers that had not been included previously. So we want to get them vaccinated in advance.
So also the governor today announced a new bridge phase, as he is calling it, from where we're actually at today to fully opening, which is phase 5. What's your thoughts about that? Do you think we're ready as a community for that?
Yes, I think we're ready for it, especially with increasing vaccination. We're starting to reopen get more in-person learning for schools. We were one of the districts and largest districts, kudos to our county and our regional offices of education that had a significant number of in-person, but we want to get to the next level. So we are ready to go for the fall with full in-person. So I think it becomes very important. Our hotels, our restaurants, our entertainment, our venues, our sports, all of those are getting it. So I think the bridge is a way to and I truly believe it's a way to dial up some capacity, be able to monitor the situation so that as we continue vaccination efforts, that we are able then to safely reopen so that we don't end up having to take steps back where we have to shut things down again. I think we all know that that's one of the worst scenarios we've got going. It really disrupts so many things and creates a much larger impact than if we are just dialing it up gradually, but, in a way that really does expand it for our community.
Yeah, so the governor said today that to move into phase 5, we have to get 50% of 16 and over vaccinated. Do you think we're going to have a problem getting there? Do you think that there's going to be enough people who want the vaccine to get us there?
Right. And I'm going to say, yes, I believe we're going to get there. I think we have to work to get there. I'm not going to, mince any words about that. But what we're finding is in most workplaces and things like that, most are vaccinated about 60%. So 50% is achievable, but I like to overachieve. I mean, I think we should push for higher than that. It's hard to say that 1 out of 2 of us would be vaccinated. And what would that look like? I think we have to work for a higher number of percent vaccinated. But at the same token, that allows us to begin to get to phase 5, which is really our return to normal and what pre-pandemic activity levels.
Couple more questions. So I appreciate your time. We'll try to rapid fire these. I know you have another appointment to get to. So are we worried about a resurgence of cases after we start to reopen more fully?
Okay, so the question is, are we worried? We're cautious, right? I want to say, because I think that, first of all, we're increasing vaccination rates. Our businesses and our workplaces are engaged with us with contact tracing. I know we haven't talked much about that. We focused on vaccination, but that's still going on in the background so that we're able to quarantine and isolate appropriately in those scenarios. And I think that, again, it's in our hands. It's in our decision-making process. I know that they were talking about college campuses, right? They canceled some of the spring break activities, hoping that individuals would not travel. And where did they find some of the college kids? Well, they were remote learning in Daytona Beach and Miami. So the challenge is we have to be responsible. And if we want to move it forward so that our fall and our summer months are really begin to look like our Rockford area, our Winnebago County, where we're enjoying our activities and our hotels and restaurants and establishments and enjoying our festivals, then we have to be the responsible individuals that really work toward that. I've said that before, and I will say that again. So the summer months are always a better time, but I think gradually that phase, that bridging to the next phase, allows us to be able to continue to monitor the situation and not advance if we're in a danger zone where we see infection rates rising. But we still have to wear our face coverings until the mask mandate is lifted. We still should be, maintain our social distancing, wash our hands, stay home if we're sick. These are still the basics that will keep us really not only protected from COVID, but right now any of the respiratory, and keep us really healthy. I mean, how many of us powered through illnesses at work that we shouldn't have gone in, and the whole office got it afterwards?
Absolutely. So appreciate the time that you've given. I'm going to try to ask a couple of these questions that are coming in rapid fire, and I know you're running behind already. So
that's all right.
Rosalie had a really good question. Does everyone have to register through Winnebago County Health Department website, and why? And just so everyone knows that, it's wchd.org, and we urge you to register.
Well, if you don't want to get a vaccination from us, you do not have to register there. But that is how we know that you want to be vaccinated and how to offer you an appointment at one of our sites. If you want to wait for your healthcare provider to contact you, you can do that. If you want to register on Walgreens or Myers or CVS, you can do that as well. But the option, though, that we do is that the reason that we're doing it is we want you to register because then we know that you want a vaccine, and we will eventually, even if no one else offers it to you, we're going to find you and offer you an appointment.
Thank you. And Doug, among others, asks a question: how long is the vaccination good for?
Well, Doug, that's a $50 million question plus. Again, we keep saying that this is a novel virus, and we're learning more about it. It's a novel vaccine as well. We're learning more about it. There is growing thoughts that we will have to have some form of a booster after completion of our primary series, maybe a year down the road. For those of you and those of us who would live through the H1N1 scenario, the H1N1 was added into our annual flu shot as the booster. So we may see that as part of, kind of that way. We also are going to learn more about the variants and how these vaccines are performing as new variants come out. So I'd like to say that you never have to have another vaccination against COVID again, but the crystal ball is looking like we are probably, the science experts are telling us that we're probably going to have a booster.
Thank you, and appreciate the time. One last question. I'm sorry, I may mess up this name, but Jesso asked, why isn't there just one designated premium vaccine that's undisputed, is reliable, and is the only one that we offer?
And Jesso, that would be easy. That would make life so much easier. And so there's a little bit of history on this. First of all, if you put all your eggs in one basket, right? If we had only said one company could manufacture and we were only going after one vaccine, we may not have gotten to the end goal. Because if that one vaccine had failed, we might not have had a product that was successful. I liken it back to those of us who are, our mothers marched for the March of Dimes. They collected dimes so that we could get vaccines against polio, and they funded the research that produced 2 polio vaccines. For those of you who remember the Salk and the Sabin, long history lesson, one was oral, one was injectable, one was a shot. And again, it was the idea being that, you want to call it warp speed, I know that was a term used, but we were going to get a vaccine to protect the population against polio. And so we were fortunate. We have 3 vaccines that came in this country that have been under emergency use authorization that are highly effective vaccines. And again, if we'd only gone after one, we might have missed the mark.
Thank you. And Dr. Martell, just want to say thank you for your time tonight. Thanks for giving me a couple of extra minutes to get some more questions in here. And just sincere appreciation for the tremendous amount of time that you've given to this community to help fight this pandemic now well over a year. And so just thank you to you and to your entire team and to all of our first responders, the healthcare workers, emergency operations center personnel, now the National Guard, and just everyday citizens who are doing the small, that may seem small things that are helping their neighbors and boosting people's spirits, and also really helping people register for a vaccine, get to an appointment, things of that nature, picking up groceries. So just want to say thank you to you and appreciate the time that you've given us tonight.
And I want to thank you for the opportunity. And again, I, echo the same sentiments of thankfulness and gratitude for the community. Remember, our goal from day one when we set out there is to get through this pandemic, get to the other side. And so we are seeing the other side. And so encourage everyone to consider vaccination. We are here for you. We want you to be vaccinated, and we will do everything we can to get everyone who wants a vaccine vaccinated.
Excellent. Thank you so much, Dr. Martell.
Bye-bye.